Onofe. I am your student nurse, and I'm asked to do your head-to-toe assessment. And do you think it's something we can do today?
Yes.
Okay. And I'm going to provide privacy. And can you tell me your name and your birthday?
My name is Akina Onofe. I was born on June 7, 2008.
Okay, Miss Seguino. How do you like to be called?
Akina.
Okay, it's Miss Seguino. So, like I said, I'm here to perform head-to-toe assessments. And the first thing I'm going to do is to check your general body to see how your body is looking. Make sure you are not in any distress. Check your ABC, your airways, breathing and circulation. Check your tubings, your catheter, your IV tubes. Make sure everything is intact, no sign of infection, no swelling, no discoloration. I'm going to check your vitals, your blood pressure, your heart rate. I'm going to check your O2. I check your respiration. I check your temperature. I check your weight, and I check your heart. And I'm going to assess for pain. Are you in any form of pain?
Not at all.
Okay, good. And the next thing I'm doing at this point is to check your neurological status. And I'm going to ask you 4 questions, which I'm going to ask again for your name
Akina Onofe.
and date of birth.
June 7, 2008.
And can you tell me the year that we are at this moment?
2025.
And can you tell me the current president?
Donald Trump.
Donald Trump. Good job. That's neurocheck alert oriented times 4. So at this moment, I'm going to position you in a good position to make sure you are in good, comfortable, and for my comfortable as well. And the first thing I'm going to do is to start my neurocheck on your head. I'm going to look and see if you have hair, which I can see visible hair. And I'm going to get my gloves at this point. And of course, neuro assessment is actually HEENT, which H stands for head, eyes, ear, nose, and throat. So that's what we are assessing for. So like I said, I'm going to check your hair. I'm checking for texture. I'm checking for color. I'm checking for any lesion. I'm checking for any dandruff. I'm checking for any lice, and the size of the head, which everything looks good to me. The next thing I'm going to check right now is your ear. Make sure both ears are visible. And Miss Igino, did you wear hearing aids?
I do not.
Okay, so I'm going to check your external ear canal. Yes. I'm going to check for any sign of drainage. Checking the other side for any sign of drainage, which I did not see. I'm going to check for the level of your hair and your eyes, which is normal. If it's not normal, then that's going to be a sign of Down syndrome. So the next thing I'm going to do now is what we call whisper test. So I'm going to go right behind you. If I'm on your right side, you're going to block your left side, and I'm going to whisper in a very low voice, and we go from there. So I'm going to start from my right side. So you're going to block your left side for me, and I'm going to say,
Mom.
Okay. I'm going to the other side. I want you to block the right ear, and I'm going to say,
Dad.
okay. You did perfect. And yeah, the next thing I'm going to check is your nose. I'm checking for, I'm checking your nose spectrum. Actually, I want to check your eyes before your nose, so I take it back. I'm going to check your eyes before your nose. The first thing I want to check is your conjunctiva. I'm going to pull down your lower lid to see the color, which is pink. That is what we want. I'm going to check for canina field gaze by pointing one of my finger. I want you to pay attention on my finger. And while I'm going to put on the lights on both eyes, I'm going to check your pupil and see how your pupil accommodates to lights. Good. Yeah. And another thing I'm going to check is your vision, the distance of your vision, how far you can see. And by that, I'm going to first use the pen light to check your canina field gaze again with the pen light before I'll check your distance vision. So I don't want you to move your head. I just want you to follow my pen light with your eyes. So perfect. You did so good. So I want you to read the name.
Olushola.
Thank you. Perfect. Excellent. And that is very good. Now I'm going to check your nose. And I'm going to check for the spectrum of your nose to make sure it's not deviated. I'm going to check for any foreign objects in your nose, and I'm going to check I'm going to check for any drainage, any bleeding. And of course, I want to make sure your nose are visible, and we have both nostril, nasal space. And yes, there's no foreign objects, no drainage, no bleeding. And the bleeding is going to determine if that is any sign of high blood pressure or stroke is bleeding from the nose. So the next thing I'm checking now is your lips. I'm checking for crackles on your lips. I'm checking for cyanosis on your lips. That's the color. And of course, if your lips is moisture, which is good, and it's very pink, that's not cyanosis. And at this point, do you wear a denture or not?
I do not.
Okay, so I want you to open your mouth. I'm looking for any missing teeth, broken teeth. I'm looking for your tongues for any crackles and any unaccepted smell, odor, which we're free from. The next thing I'm going to do now is your neck. I'm going to check your cervical lymph node for any swelling. Checking your neck for any swelling. I'm going to check for gallbladder. Can you swallow for me? I see movement. That is a good one. And I'm done there. The next thing I'm going to do now is your respiratory check. I'm going to listen to your lung sound. I'm going to listen to 10 spots. And whenever I place my stethoscope, I want you to take a deep breath. But before I listen to the lung, I'm going to check the texture, the color, and check your skin for any lesion, which everything looks good to me. No sign of no lesion, and I didn't see any abnormal feelings. And now I'm going to listen to your lung sound. Perfect. I just listened to your sound. It was clear. There's no crackles, no wrinkle, and no wheezing. We're gonna do the same thing in the anterior. Like I said, whenever I place my stethoscope, I want you to take a deep breath. And before I do that, I'm gonna check your chest, the texture of your chest. I'm checking the color of your chest. Check for moisture. Check for any discoloration, and of course, I'm gonna check for the temperature of your chest. And of course, I'm gonna listen to 10 points on your chest. And like I said, whenever I place my stethoscope, to take a deep breath. Good. Lung sound is clear. No crackles, no wheezing, no bronchi. Now we're gonna go and listen to cardiovascular system. And I'm gonna inspect the chest, check for the temperature, the texture, the color, check for any lesion, and everything is good to me. So I'm gonna listen close to the sternum in the chest for your out sound. I'm going to listen to, I need to hear the S1 and S2, the lob dub sound. If there's any abnormal sound, then I'll notify the doctor. And I'm going to start the second intercostal space, the right second intercostal space, which is the aorta. the second left intercostal space, which is the pulmonic. The third intercostal space, the left third intercostal space, which is the abs point. And the fourth left intercostal space, which is the tricuspid point. And I'll go to the biospic point, which is the fifth intercostal mid clavicle space, and that is where we have the apex pulse. I did not hear any abnormal sound. S1, S2 is active, normal. I can hear low and dove sound. And the next thing I'm going to do now is to check for your pulses, your pulse points. And I'm going to start from your temporal point, which is right here, close to the ear. I can feel your pulse. Then I'm going to check for your carotid pulse. It's right here, I can feel it. The next pulses is your brachial pulses, which is right here. I can feel it. And the next one is your radial pulse by your wrist. I can feel it. And we have your femoral pulse. It's right by your bone area, right here. And your popliteal pulse is behind your nail. I can feel it right here. Then your posterior tibial pulse is right here. I can feel it. And your dorsal pedal pulse is right by your ankle, and I can feel it. And that's your 9 pulse points. The next thing I'm going to do right now is to check for your GI, which is your abdomen. But before we go ahead and do that, I want you to tell me, when last do you have your bowel movement?
About 30 minutes ago.
Okay. And can you tell me deformity, if it's loose or formed?
It was formed.
The texture of your BM, like is it brown or dark?
It was brown.
Good. And is it your normal pattern of the way you usually defecate, have your bowel movement?
Yes.
Okay. So at this point, I want you to relax on the bed with your back. Yes. So this time around, I'm inspecting your abdomen. I'm inspecting the size, the shape, the symmetry of your abdomen, and the texture of your abdomen. Feel your temperature. See if there's any lesion, discoloration, abnormality, which I'm not seeing. So I'm going to proceed to listen to your abdomen. I'm going to listen to 4 quadrants of your abdomen, and what I'm looking for is the active of your bowel sound. If it's normal, if it's hyper, or if it's normal active, or if it's hyperactive, or if it's lower hypoactive. So I'm going to check. I'm going to auscultate with my stethoscope. And I'm going to start from the right lower quadrant. Whenever you verbalize, whenever you feel pain, please let me know. Verbalize and let me know. And I'm going to be listening for at least 5 to 15 seconds to get the actual sound. I'm going to go to right upper quadrant. And the next thing, I'm going to the left upper quadrant. And I'm going to left lower quadrant. Bowel sound is normal. I can hear it's active, but it's normal. The next thing I'm going to do right now is to inspect, auscultate. I'm going to palpate. And I'm going to palpate from the right lower quadrant. I'm looking for any distension or any abnormality, any masses. Whenever I palpate, I'm going to kind of press. If you feel pain, please verbalize. Then I'm going to stop. But so far, so good. I didn't see any abnormality, so we're good. So I'm going to start from the right lower quadrant. Going to the right upper quadrant. Left upper quadrant. And left lower quadrant. And I did not feel abdomen is soft. There's no abnormal findings, no distension, and there's no abnormal organ. At this point, I'm going to percuss, and I'm going to start from right lower quadrant. If you verbalize pain, let me know. Yeah, there's no abnormal findings, no abnormal tenderness. At this point, I'm going to make you sit down, and I'm going to I'm going to check for your urine, and after that, I'm still going to make you lay down to check for your Mike's burning point for any rebounds, distension. So can you tell me when last you urinated?
About 30 minutes ago.
About 30 minutes ago. Can you tell me the frequency of the urine?
It was pretty normal.
And the color of the urine? Pale,
Light yellow.
dark, like yellow. And the odor of the urine?
No odor.
Okay, so I'm going to document that. Do you know the amount of the urine, like between 200, 100?
Yes, 200.
200 ml. Okay, can you lay down for me again for me to palpate your nervous side? This time around, I'm palpating your Mike's bonus point. Do you feel any pain?
No,
Yes,
no.
and I did not feel any abnormal organ or rebound tenderness. So you can get up now. So now we're going to do your musculoskeletal system, and I'm going to start from the upper extremities. And of course, I'm going to see your two hands. Make sure your both hands are visible, and I'm going to check for your texture, temperature, color, and lesion, which everything okay. So right now, before we go, I'm going to check for skin turgor. That is very good. The rapid drop is what we're looking for. I'm going to check for capillary refill, which is less than 2 seconds. Very good. Can you elevate your hand for me for range of motion? Good. Down. Can you bend, flex and extend it? Very good. At this point, I'm going to want you to squeeze on my finger for me to feel your strength, and I can feel your muscle. I think I'm good on your upper respiratory, and now we're going to go for lower respiratory. Of course, I'm checking for turgor, and I'm checking for capillary refill. I'm checking your heel for any pressure, and your calf. I can't see any swelling. There's no pitting edema, no swelling in the calf. And I want you to kind of what we call pull and push. I'm going to place my hand behind you. I want to push on me to see how your muscle goes. Push, back, like okay. So this is called adduction. What you're doing is adduction, which is good. And when you bring it back in, is abduction, which is good. Now I want you to push. Good job. So I'm going to put my hand behind you, then press on me. Good. And that's what I'm looking for. So the next thing we're going to do, I'm going to check for I want you to stand, bend forward. I'm checking for your spine for any deformity, which is good. I didn't see any deformity at this moment. At the same time, I'm seizing this opportunity to check your sacral area for any pressure, redness, your coccyx area for any pressure, which everything looks good to me. And before I make you to sit down, I will want you for me to check your gait balance. So I'll need you to walk back and forth. So when you go in, I want you to tiptoe and walk on your toes down to the door. Thank you. Yes, good job. And when you're coming back, I want you to walk normal. Yes. Thank you. And that's a very good, your balance. I can see your balance is okay. And I want you to sit down back. At this point, I'm going to document my assessments. I don't have any abnormal findings, so I don't have any reason to call your doctor for any order or lab work. Everything looks good to me. At this point, I'm just going to pull the call light within reach for you. I take off my clothes. I wash my hands. And Mr. Eno, I really appreciate your time with me today. It's my pleasure working with you. If you need anything, let me know. This is your call light. And that's the end of my assessment.
Thank you.
And I close the door.